So, good morning and good afternoon to our viewers in India and abroad, and a very warm welcome to our esteemed guest, Dr. Peter Brukner. Dr. Brukner is a medical doctor, and he has had two passions during this medical career. His first passion was sports medicine. Dr. Brukner is a world-renowned specialist sports and exercise medicine physician and researcher as well. He has been a team doctor to Australian national swimming, hockey, athletics, soccer, and cricket teams, as well as Liverpool Football Club in the English Premier League. He was Australian team physician at the Atlanta Olympics and team manager at the Sydney Olympics. However, Dr. Brukner's second passion is around nutrition. Why? He believes we have epidemics of obesity and chronic diseases such as type 2 diabetes owing to consumption of wrong foods. And to tackle this, Dr. Brukner has founded two public health initiatives in Australia. The first being Defeat Diabetes, and the other one is SugarByHalf. He has also authored the best-selling book, A Fat Lot of Good. Personally, I'm a big fan of your lectures, sir, at Low-Carb Down Under, and those are quite intense and humorous as well. So across his illustrious career spanning across 5 decades, he garnered a number of titles, citations, and roles at the highest level. Now, let me take the honor to quickly introduce Anup Singh here. He can be regarded as the pioneer of low-carb movement in India and is also the founder of D-Life, which is an e-learning and community platform for low-carb. So, Anup Singh, do you want to add anything on that?
Yeah, first of all, good morning, good afternoon, everyone. And basically, I'm a type 1, type 2 diabetic since 2011. And I've been living low carb since then, and pill-free life and non-diabetic numbers. The platform is basically now the largest and the only platform for Indians anywhere. And we started as a community, and now we are into, providing certification courses with the primary aim of building an army of low-carb coaches. So welcome, Doctor.
Thank you. Thank you for having me. Thank you for inviting me. It's a pleasure to. I've loved my visits to India in the past, and I'm very fond of the Indian country and the Indian people. So it's a pleasure to be here.
Amazing. And thanks again for accepting the invite and providing your valuable time over here, Dr. Brukner. So our discussion today will be broadly based on two topics. One is about the low carb in sports, and the next one is about your recent mission to improve Australian population's metabolic health through our initiatives, typically Defeat Diabetes. So it will be broad-based on these two topics. So let's start with the sports nutrition and your career across 4+ decades with sports, right? So and then you have worked with the sports teams, national, international, Olympic level teams at the highest levels. So are there any significant changes that you have seen in athletes and typically to do with their nutrition over the last 4+ decades?
Yes, well, I really grew up in the carbohydrate era. It was carbs, and
yeah.
But every athlete was told that you've got to carbs are the best fuels, carbohydrates are the best fuels. We need to fill up our muscle glycogen. And we had pasta parties the night before the marathon, and lots of sugary drinks, Gatorade and Powerade and so on, and gels while we were running marathons. And it was really it was all about carbohydrates. And there's no doubt that carbohydrates are an official fuel. An efficient fuel. There's no doubt about that. But my concern, really, with that whole generation is that we've had a generation of athletes who've had incredibly high levels of carbohydrate intake, mainly in simple sugary sort of carbohydrates, and I'm really concerned about the long-term effect of that. I think many of them would have developed insulin resistance and go on to type 2 diabetes and all the complications with that. So I think we really needed to rethink our whole way of fueling the athlete. And I guess in the last sort of decade or so, we've become aware, initially through the works of Jeff Follick and Steve Finney, and more recently through people like Tim Noakes, that there is an alternative fuel to carbohydrates, and that's fat. And we've sort of lived through the whole era of demonizing fat and the low fat high carbohydrate world, and so it's taken a real effort for people to get their head around the fact that maybe fat is okay, and fat can be a very efficient fuel for the athlete. Now, my one rider is that probably at a very elite level,
Mm-hmm.
at a very high intensity level, that carbohydrates are still required.
Yeah.
For most people, but for the vast majority of people, they can fulfill their exercise needs on a low carbohydrate, high fat diet, because fat, as I said, is a very efficient fuel. It also has a number of other advantages. Probably the first one from the athlete's point of view is that you don't have to keep eating, or keep drinking. You see, someone doing an Ironman or a marathon, having to constantly be drinking and eating gels and eating bananas and things to fuel themselves. Whereas if you're running off fat, you don't need to take on any extra fuel at all. And I've had people do Ironman triathlons and just on water. And so that's a big advantage. The second one is the recovery, and that you just seem to recover a whole lot better when you're running off fat than you are off carbs. Carbohydrates, and especially the simple sugars, are quite inflammatory and cause a lot of sort of muscle soreness and muscle damage. And we've noticed that people recover so much better and are able to resume training after a hard race much quicker when they fuel themselves with fat, and that's certainly a case. And also injury-wise, I've had people who have sort of arthritis or tendonitis, might have Achilles tendonitis. They seem to do much better on reducing the amount of sugar in their diet, because, as I said, sugar is inflammatory, and they do better on a low-fat diet. So there are a number of advantages to having fat as your main fuel, rather than carbohydrates. Now, there is a lot of individual variation, as I said. I've had people, at high level of professional sport be totally ketogenic, but I've had others who've been largely sort of ketogenic during the week, maybe, and then on match day they feel as though they need an extra sort of a little top up, or a cyclist who feels, no, I just need to get up those hills or to sprint, I just feel as though I need an extra gear and I need some carbohydrates. So the world of sports nutrition is gradually changing from this obsession with carbohydrates into more individualized, personalized nutrition, and depending on your training load and on basic, maybe low to medium level training days, people will just use fats as their fuel, and then maybe on high intensity training days or competition days, they'll top up with some carbohydrates. So it's an evolving area. There are still a lot of dietitians and experts who think that carbs are the only fuel for people, but I think it's now shown quite clearly that fat is a very efficient alternative fuel for the athlete, with lots of side effects and other advantages.
Sure. Thanks. And that was a very powerful insight into sports and how essentially we should be looking at carbs and fats. So I think my one-line takeaway for the viewers over here is you absolutely don't need carbs on most of the days. I think on championship days or maybe elite kind of performances, you might require, or you can do some mix and match just in case if required, at the highest levels. But most of the times you don't need carbs to load yourself with carbs, let's say, for your any kind of an endurance or any other sporting event as such. So that's an amazing. I think you mentioned about injuries, so I was about to be coming to that. So are you seeing, let's say, any negative or positive impact, let's say, on a sports performance when it comes to, let's say, embracing low carb as a diet or maybe ketogenic as a diet for athletes? Is it getting better, or are there any issues that you're seeing?
No, I think it definitely is an advantage. I've seen a lot of people with chronic injury problems do a whole lot better with when they drop their carbs that are causing the inflammation. And I think that's a really important breakthrough. That we're currently doing a study at my university looking at the effect of what we call an anti-inflammatory diet on knee osteoarthritis, for instance.
Yeah.
And the initial results are very encouraging. That people are having less pain, better function, and hopefully those results will be out in the next year or so. But it certainly is a weapon that we didn't realize existed in the sports medicine world. We tend to sort of use a lot of medications and anti-inflammatory drugs and things, and yet there's just as effective, I think, is the dietary approach by reducing the inflammatory the foods that cause inflammation, and they're basically the highly processed foods. So things like foods that contain sugar, but also foods that contain vegetable oils are quite inflammatory. So the ultra processed foods that unfortunately are sort of taking over in both of our countries, I think, as a sort of staple diet, they are quite inflammatory, and we need to get back to eating the way that our previous generations ate real food, rather than this very processed food, which is quite inflammatory in nature.
Absolutely. And coming back to our topic of discussion about injuries, and being an ardent cricket fan, and I know, I mean, you worked at the highest level when it comes to cricket, but there is a famous, I think, incidents that I can recall with a great Australian cricketer, Usman Khawaja, and he came across the knee injury, and I think there is an episode happened after that, and he became probably the number one batsman after that, after the kind of, let's say, a rehab that he went through. Can you throw some light on that, because that's an interesting one for most of the viewers who are here?
Yeah, well, it certainly changed the way I think about things. So this was 10 years ago now, and we're actually in your country, in India, touring India with the Australian cricket team. And Usman Khawaja at that stage had a lot of injury problems. In particular, he had a knee injury, and the source of the knee injury was unclear, and no one could really work out what the problem was with his knee. And he'd had a lot of tests. He'd had MRI scans, and he had arthroscopy, and they couldn't really work out what was going on. And he didn't play cricket for at least a year. And so then he'd seen a doctor in Sydney, and who diagnosed him with a condition called seronegative arthritis, which is basically like a rheumatoid arthritis, but not exactly rheumatoid, similar to rheumatoid, and placed him on some drugs, and some quite powerful drugs, some cortisone and so on, and that helped him a little bit. And then put him on a very powerful drug, which is a tumor necrosis factor inhibitor, if you want the science. But it's a very expensive drug. It costs about 10,000 Australian dollars a year for this drug. And when I met him, he was injecting himself with this drug once a fortnight. And he said it could have controlled his knee pain reasonably well. He was back in the Australian squad. He wasn't in the actual team, but he was in the squad on tour. But he couldn't train fully, and I think the coaches thought he was a bit lazy. But he was restricted in what he could do. And he said at about 10 days after his previous injection, into that sort of fortnight, his knee would start to ache, and he'd know, it's time for my next injection. So he approached me on that tour, and he said he was interested in losing a little bit of weight, and which is an interesting thing, because it amazes me how so many elite athletes who basically spend their whole time training are actually a little bit overweight, and that always sort of mystified me. I now understand it, I guess, because of their diet. But anyway, so I just lost a whole lot of weight, which everyone had sort of noticed, and so on, when I started my low carb journey. And he said, "Look, I'd like to try what you did." And I said, "Sure." And I said, let's do that. And he basically went on a low carb diet, stopped eating all bread and rice and pasta and so on, and just ate ate a very, real food sort of a diet. And the good thing about working with these people is that they're very disciplined, and he was very disciplined about what he did, and he started to lose a little bit of weight. And about 3 weeks later, he came up to me and he said to me, "Doc, I forgot to have my injection last week." I said, "Well, what do you mean?" He said, "Well, I haven't had any knee pain, and I forgot to have my injection. Should I have it today?" And so I pretended that that's exactly what I expected. He had no idea, of course. And I said, "Look, why don't you wait and see what happens?" Anyway, to cut a long story short, he didn't have to have any further injections. He managed to. He had no knee pain. He managed to increase his training. He got back into the Australian team. 12 months later, he was in the top 10 batsmen in the world, and he's still playing now. It's now more than 10 years since then, and he's still at the top of his. I think he has the highest average as an opening batsman of any athlete, any cricketer in history. So that really opened my eyes for the first time, I guess. And we're all learning all the time as clinicians, and that really opened my eyes to the effect that nutrition could have on inflammation. And Usman still he's still low carb, and he's still passionate about it. And we see each other occasionally, and we all have a laugh about that time. And he's very grateful. And he's now got a family, and they're all eating in a very healthy way. So it's a great story, but in particular, it was just a really important learning phase for me. I mean, I'd had two sort of big moments, really. I mean, one was my own experience. And then secondly, this one that opened my eyes to the effect that, and so I've been encouraging most of my athletes now to reduce their intake of junk food and processed foods, and try and make them get them eating more real food, lower carb food, and many of them have really really done well with that.
Amazing. And what entices me is the fact that he's already in his late 30s. I mean, Usman Khwaja in his late 30s, and he's been playing after that particular incident, that particular injury, which was almost threatening to his career, it seems. I mean, that's what I've read in the press and things like that. So that's an amazing story, success story. So taking this thread forward, Dr. Brukner, I mean, I would like to understand, while there are so many of these, I mean, these success stories which we get to hear, but are you seeing or have you experienced any pushback from, let's say, athletes or sports management teams, anything on those lines? Like, I mean, a consistent trait that we are discussing across different sessions is, let's say, in terms of your own country, are you facing any kind of challenges, right? I mean, with respect to, let's say, from governments or any other organizations or things like that. But here, I think I want to put it in a little different perspective. So do you see any pushback happening from, let's say, athletes themselves, that I don't want to, they're scared, or they're probably not willing to be getting into low carb or things like that, or maybe the management team, those kinds of things?
Yeah, the athletes themselves are usually pretty quite open to the idea. I mean, they're always looking for ways of improving performance and reducing injury. That's the two things that they really want. And many of them have come to understand that that's a potential way of doing both. But there are certainly plenty of athletes who are very firmly wedded to the carbohydrate model, and that's fine if it works for them. That's fine. I think the major impediment really is the dietitians. The sports dietitians have all grown up, being educated and with the carbohydrate obsession, and so they're quite a challenge. I know with the cricket team we had a dietitian, and she and I didn't really totally agree on things, and the diet was her responsibility. But after a while, the players started coming to me and asking me about the diet and so on, because they'd seen the success that other people had had and so on. So yes, there has been a lot of pushback. There has been some sort of official pushback. I think you're speaking to Dr. Gary Fettke today, and he'll no doubt tell you his story. And but I think we've gone past that. Fortunately, I think there's now much greater acceptance of this as a really realistic alternative to to the traditional dietary model, and there's lots more interest, particularly among young people and particularly among young doctors. We find a lot of young doctors are actually practicing this way of eating themselves and are much more positive about it than maybe the previous generation of clinicians who all grew up. Look, I quite understand why it's difficult for doctors and dietitians to sort of change their whole do a 180-degree turn, if you like, in the way they the advice they give. I mean, if you've been saying one thing all your career, and all of a sudden, some crazy people come along and say, we think you might be wrong, and so on. I can understand their resistance to that, and I can see that. But I think what we need is just more and more evidence, more and more scientific evidence, of which there's starting to be an increasing amount, which is why we're doing some of this research we're doing into arthritis and other events. I'd love to do a study on tendinitis next. That's next on the agenda, and see how we can improve that. So yes, there has been pushback, certainly, but less and less so all the time.
Yeah.
And some of the official bodies, some of the medical bodies. There's the main diabetes organisation in Australia is called Diabetes Australia, and they are very interested in what we're doing and looking at coming on board with us as well. So things are changing, certainly, and interestingly, I think it's been driven by the public, by patients. I think patients have been educating their doctors, which sounds like a crazy thing to happen, but I think patients are coming into their doctor and having gone onto a low carb program and improving their diabetes or their weight loss or whatever, and the doctors are having to take note, and some of them try and pretend it didn't really happen, but after a while you have to admit that there's something going on here, and I think they've played a really important role in educating my profession.
That's really encouraging to know the things are changing for good. And I think different perspectives I've got. One interesting is about the patient-doctor relationship and how doctors are probably becoming learned, right? I mean, for whatever reasons. I mean, not discounting what they have been doing or what they do, but that's a very different perspective. Thanks for sharing that. And we are really looking forward towards your study and research on tendons, right? I mean, tendinitis, because I think actually tendon is one of the worst kind of injuries that any athlete or maybe runner come across. So that's an amazing thing.
What people don't realize is that the doctors don't know much about nutrition. I mean, everyone assumes doctors know everything about everything, and they really, I mean, I did not have a single lecture on nutrition in my 6 years of medical school. Now, that was a long time ago, but last century, but it hasn't changed much.
Yeah.
And so, in a way, I sort of understand that doctors are reluctant, because you tend to stay in your comfort zone, and the comfort zone for medical practitioners is medications and surgery, and so that's what we recommend. I mean, we're not well educated on exercise and nutrition and these areas, so we tend to sort of steer away from them and focus on the things that we know, and that's one of the challenges, that we have to educate our medical students and our doctors much better in the importance of nutrition and the role that nutrition and exercise can play in the management, particularly of chronic disease.
Yeah, and that's, I think, very much a healing-focused approach that should work. I mean, that's the way. India, right? I mean, when it comes to sports. So what are your views? I mean, let's say we are almost there. I mean, in terms of the most populous country. And the performance that we have at the World Championships and Olympics and other levels, sporting events, is not at par as compared to, let's say, the population. What comes to your mind in terms of improving this particular situation? What can be done, just in case?
Well, there's no one simple solution. I'm sure if there was, then someone would have tried it already. I mean,
anything to do with nutrition? Anything to do with nutrition?
Look, I think it plays a role, certainly. I think obesity and overweight is a massive problem in virtually every country now. We've gone from concerns about being underweight to in a generation we've gone from being more concerned about overweight, and so I think that is a real problem, particularly in children. I think the obesity rates and the rates of overweight in children are skyrocketing, and that obviously impacts on their exercise and their sport and so on. So I think we really need to address the dietary issues, particularly in children. They tend to have very poor diets these days. A lot of junk food, a lot of fast food, a lot of highly processed food. Yes. And I think that can affect a whole generation of children, and they're makes it much more difficult for them to become elite athletes. And so I think definitely nutrition is a significant factor. I'm not suggesting it's the main factor, but there's a lot of factors that need to go into sporting success. And unfortunately, these days, a lot of it is money. That government's putting money into elite sporting programs and so on, and that's what countries like Australia did in the early 2000s, or leading up to the Sydney Olympics, put a lot of money into these programs, and Great Britain followed suit and took over from Australia, really as one of the top nations behind the really big countries. So and that required a lot of funding, and again, that's a matter of priorities, and I'm not going to get into that issue of whether it's more important to spend money on schools and hospitals or winning gold medals. I mean, that's a difficult one, but I think the important thing is not so much winning gold medals, although that does inspire a generation of younger people. But I think the main thing is to improving the health of the nation, and I think diet and exercise are the two key factors in that. We need to have our younger children, our children and adolescents, eating well and exercising regularly, and then as a result, if there's opportunities there, if there's programs there, then the elite talent will come forward and be successful. But unless we get the basics right, then it's going to be very difficult, I think, for to be successful.
Right, and it would be, a lot more interesting to discuss on sports, but let's move on to your own journey, right? In terms of what made you embrace low carb in first place, and which happened probably around 11 years back. But if you can just share some stories around that.
Yeah, that's right. Well, I was 60 years old, which was the age that my father had developed type 2 diabetes, and so I was very aware of the potential for getting type 2 diabetes. I was living in Liverpool, England, working with the football club there, and if you'd asked me at the time, how was my health, I'd have said, I'm okay. The reality was that I was metabolically quite unwell. I was overweight, borderline obese, and like many sort of middle-aged Australians, I'd probably put on, half a kilogram a year for 30 years, and just gradually got thicker around the waist. And my children are sort of, poking me in the stomach and saying, come on, Dad, it's time to lose some weight. And I would shrug my shoulders and say, well, look, I'm on a low-fat diet, as recommended, and I exercise, and, it's not my fault. And as well as that, I'd had a fatty liver on my blood tests for the previous 10 years. And to be honest, at the time, I didn't really understand what a fatty liver was. And I figured I was on a low-fat diet, so I was probably doing the right thing. And like most doctors, I ignored my own health warnings. And I had a high triglyceride levels and high insulin levels and so on. So I clearly was metabolically unwell. And in retrospect, I was obviously pre-diabetic. But I didn't realize it at the time. I thought I was fine. And it was my colleague Tim Noakes who got me onto it. Tim and I are old friends. We've known each other for a long time, both in the sports medicine, sports science world. We would Tim and I would often be the only two sort of non-Americans at some big North American conference, and we'd catch up in a corner and talk about cricket and rugby rather than baseball and American football and so on. So we're all friends, and I'd also admired Tim's intellect enormously. He challenged a couple of the tenets of sports science over the years and been proven right. And so when he came out, I think it was early 2012, and said, no, we've got all this diet thing wrong. It's not fat that's the problem, it's carbohydrate, and talked about the way he'd reversed his own type 2 diabetes. My initial response was, "Oh, come on, Tim! You've really lost the plot this time.
Yeah.
That couldn't possibly be right. The whole world couldn't have got this wrong for the last 50 years." But because it was Tim Noakes, I guess I thought, no, look, I should look into this. And I bought a book by an American journalist called Gary Taubes called "Good Calories, Bad Calories," and I guess realistically, this was the book that changed my life. And I read, started reading this book, and I got more and more into it. And because not only did the book talk about the relative merits of fats and carbohydrates and so on, and present a very good argument for that, it talked about the politics of how the sort of the low fat movement had won out over the low sugar movement back in the 70s. Now, which I'd always assumed was on the basis of good science and evidence, and turns out to be money and politics, and we should have guessed, really. And this book just blew me away. I distinctly remember sitting on the edge of my bed at night, after reading some of it, thinking, no, this couldn't be right. We couldn't have got something as basic as the whole Western world and actually been on this low-fat diet for 50 years. And here's this guy saying, it's wrong. I mean, I found it quite disturbing, actually. So I finished this book, and I thought, no, look, I need to know more about this. So I dived into every book and journal article and magazine article and everything I could get my hands on for the next few months. And I guess I'm a little bit OCD, but anyway, I really dived into it. And the more I read, the more I thought, no, I think he's right. I think we really have got it wrong. So then I decided, well, it was time. I'm a scientist, or a pseudoscientist, and I decided it was time to do a little experiment.
Yeah.
But I also knew that an experiment with an n equals 1 is a waste of time, except when the 1 is you. And so I decided it was time for my own n equals 1 experiment into low carb. So I decided that I would do a 3-month trial of adopting a low carb diet. So on day 1 of the 3 months, I got my bloods taken, and I showed all the things that I'd mentioned, the fatty liver and the high triglycerides and so on. And I weighed myself, and I embarked on a low carb diet for 3 months, and stopped eating, all the foods that I'd been eating a lot of, rice and pasta and cereal and bread, potatoes and all processed food, or sugary foods. And I went back to eating probably the way that my grandparents would have eaten, just real food, sort of meat and fish and green vegetables and eggs and dairy and all the things that we've been told were bad for us. And it felt quite strange, actually, because when you've been told things are bad for you for a long time, and all of a sudden you're trying that, you sort of felt quite strange. But the only fruit I ate was berries. I had some nuts and seeds, and my 2 little indulgences were a little square of dark chocolate, in the evening, and maybe the occasional glass of red wine. But I really I was pretty strict on that for 3 months, and then things started to happen pretty quickly. Initially, I started to lose weight pretty much straight away. But the first thing that happened was that I stopped being hungry. So instead of sort of having my cereal for breakfast in the morning, and then getting to 10:30 in the morning thinking, gosh, is it lunchtime soon? I would have my eggs and bacon and avocado or something for breakfast, and then not eat again all day. And I went from eating 3 meals and 3 snacks a day to eating 2 meals a day, and I basically stick to that to this day. And then I started to lose weight. Every week I'd get on the scales and I'd lose weight. Initially, I thought, oh, that's just initial luck, if you like. But it just kept happening. But also, I just felt much more alert. I had more energy. My exercise improved. My sleep improved. Everything just seemed to work a whole lot better. And so at the end of the 3 months, I'd lost 13 kilograms in 13 weeks, and felt great. And I did my bloods again, and my fatty liver that I'd had for 10 years had completely disappeared. My liver function tests were back to normal. My triglycerides were normal. My insulin was down to normal. And basically, I'd resolved all my metabolic health issues in the space of 3 months. I mean, it may have been less. I only did my blood test after 3 months. So, and this just blew me away. I mean, I just couldn't believe that you could have such an impact by changing what you ate. And I guess, many of us have, many of your audience, I'm sure, have been on a similar journey. And you've got one or two choices when that happens. You can either say, well, I'm okay, I'll look after myself, and that's it, or you could you could spread the word, and I decided to do that. I didn't really have much choice, because everyone would come up to me and say, my gosh, what have you done? You look, you've lost so much weight and you look so much healthier, and so on. So I started to continued reading a lot about it, started talking about it, then started writing about it. Then we started this campaign called SugarByHalf in Australia, with the aim of reducing the amount of added sugar by a half. The average Australian probably has nearly 20 teaspoons of added sugar a day, and we wanted to get that down, at least by a half, and down to recommended levels, and so on. That program has been going for a few years now. We've got a good schools program. We've got lots of lessons that we've designed for school teachers to promote the low sugar movement in schools, and that's been rolled out to a lot of schools in Australia. And then I was approached to write a book, and I sort of by Penguin, one of the big publishers, and my initial response was, the last thing the world needs is another diet book. But they convinced me that there were very few by Australians, or by Australian doctors in particular. And so I wrote a book called Fat Not a Good, which has been a great big seller. It was on the bestseller list for a number of weeks, and it's really done well. And I've had a lot of great feedback from people who tell me that their lives have changed as a result of that book. But then the elephant in the room really has always been type 2 diabetes. And, it's such a common condition. Nobody talks about it. It's not, it should be, right up there in the top of everyone's concerns. But it seems this hidden epidemic. And I've sort of was wondering why. And I think the reason is because people don't die of type 2 diabetes. Mm-hmm. They die of all the complications, as we know. Type 2 diabetes is a major cause of blindness, a major cause of kidney disease, of amputations, of heart disease, of Alzheimer's, and all these things. But it's not the type 2 diabetes that kills you usually. And yet there was evidence starting to come out from overseas that type 2 diabetes isn't necessarily a chronic progressive disease, as we're all taught in medical school, and that you're on medication for life, and you're just going to inevitably get these complications. That you can actually put diabetes into remission. And there are a couple of programs, one in the UK, diabetes.co.uk, and one in the US, the Verta program, that have shown that using technology and using an app can be very effective in putting type 2 diabetes into remission, or certainly improving diabetes control. So initially we thought, well, that'd be, I kept waiting for someone to do something, and nothing was happening. So I thought, I might have to do something myself. And initially we spoke to the UK people about licensing their program, but that didn't work out. So we decided to take the plunge ourselves, and that was during COVID lockdown period. So it was a good project to do that. And I got together with a colleague of mine, Dr. Paul Mason in Sydney, and a dietitian, Nicole Moore. And we designed a program which we called Defeat Diabetes, which we initially released as an app, and now is both an app and a web-based program. And we basically put together sort of 13 lessons, if you like, consisting of videos and articles about everything you need to know about what is type 2 diabetes, and what effect diet has on it, and very practical advice about going low carb and so on. And as well as those videos and articles, we have lots of recipes, hundreds of recipes. We have meal plans. We have cooking videos. We have a very large Facebook group of people, subscribers, who are very active and always putting up new ideas or questions or recipes and so on. So it's still, it's still going slowly. We've had 10,000 people subscribe to the program. The results have been astonishing. I mean, very similar to those overseas, but basically, 50% of people who go on the program, more than 50%, reduce their HbA1c levels, their diabetes markers to the non-diabetic level, and the rest have all reduced it remarkably. And everyone who's been on insulin has got off their insulin, and people reduce their and look, it's just confirming the results from other programs through David Unwin's group in the UK and others, that it is possible to put type 2 diabetes into remission. And that's something that it's just not even talked about in the medical profession, and it's very exciting. I think it's really it's so exciting the great thing is that it gives people with type 2 diabetes hope. Because at the moment, you have a diagnosis of type 2 diabetes and there's no hope. You've been on medication for life. You're going to develop these complications. Whereas now, there's hope both for the patient with type 2 diabetes, but also with the clinician and with the doctor, because it's pretty depressing. And type 2 diabetes is arguably the most common disease that the GPs see in their practice, and there's really not been anything you can do for these people. And now all of a sudden there's something that you can do that will really help these people. So it's giving hope to both the patient and the doctor that they can do something. So we're really excited. We have another research project going at the moment, looking at a group of 100 people with type 2 diabetes through their general practitioners, enrolling through their GPs, who then put them onto the Defeat Diabetes program and then monitor them every 3 months with blood tests and various tests and so on. And we've got the early results from that after 3 and 6 months, and it's very similar. That more than half are putting their diabetes into non-diabetic levels, which is very exciting. So I think it's exciting times ahead in the world of type 2 diabetes.
Yeah. And as we have already segued into the Defeat Diabetes initiative, I would probably hand it over to Anup. He possibly would have a question about Defeat Diabetes. I mean, we are anyways looking at, let's say, a long-term collaboration, if that can happen across different entities, who are working in this particular space of low carb. So Anup, you have anything to say or ask?
Yeah, actually, first part was pretty interesting and it covered mostly the sports nutrition part. And I was going to come to this Defeat Diabetes initiative of Dr. Brukner, because for us, the non-sporting segment is the primary, area of focus, where the Defeat Diabetes program like yours, we have in India, what we have launched 9 years back is the dlife.in. So as a, founder of that platform, my interest was what impact actually it is making in the general non-sporting Australian population. That is question number one, and I'll follow up after this.
That's right. Yeah, look, I agree with you. I mean, I think the sporting thing is very interesting, but it's the impact on the general population that is far more important. Sport is great. It's great fun and it keeps a lot of us entertained and so on. But the real concern is the metabolic health of this generation, and we are so unhealthy. I mean, metabolic disease is everywhere and seems to be increasing very steadily throughout Western countries. Certainly, I read a statistic recently that only sort of 12% of Americans were metabolically healthy. To have one of the sort of factors that have metabolic syndrome, and that's a really scary thought. So, I think programs like Defeat Diabetes and your own program are just play a really important role because we need to get to the average person, to the public, and it needs to be accessible and it needs to be not expensive. Because we know that there is a sort of a socioeconomic bias to metabolic disease. That it tends to affect lower socioeconomic areas more than the higher, maybe who can afford to have better nutrition, better food, and so on. So, these are the challenges that we have, in that we have to give people access to programs such as the two that we put together, and promote it. And so we've certainly faced challenges with Defeat Diabetes, trying to get publicity, I guess. It's challenging. There's social media. It's become more challenging to publicize things on social media over the last couple of years due to the restrictions and so on. So we've got a little bit of general media publicity, when we launch and when we put our books out and so on. You can get and whenever that happens, we get a spike in subscriptions. It's all, but the rest of the time it's just word of mouth. What we're finding now is that more and more doctors are advising their patients to go onto a program like this. So, a patient comes in to see a doctor. As I mentioned before, the doctor's not that well versed in nutrition. They also don't have a lot of time to talk to patients. So they're finding it very valuable to just recommend a program like ours, and then just monitor the patients over time, and the patients can get their nutrition information, if you like, from programs such as ours. So it's certainly challenging. We've been going 2 years now. I had hoped that we would have more subscriptions that we have, but we have a relationship now with Diabetes Australia, who are keen to promote our program, because they believe in it as well. And so we're optimistic that over the next couple of years we'll get a lot more people. Interestingly, also, you might be curious to know that we actually have a parliamentary inquiry into diabetes in Australia. And a number of us have made submissions into that inquiry, and next month I'm appearing before the inquiry. And there's a number of doctors on that. We have a number of doctors who are parliamentarians, and we have a number of doctors on those. And so we think that might be a really important initiative for government, because there are certainly things that government can do to make life easier for people with type 2 diabetes, both in prevention and in management.
Yeah. So as you said, Defeat Diabetes is around 2 years old, right?
Yep.
Yeah. So can you walk us through the average improvement that you see in the primarily diabetes numbers, or any associated numbers with diabetes?
Yeah. So our we've done two types of evidence, really. We've done a survey of our members, and then we've also done this research project that's now well underway, and we have 3-month data and 6-month data. But basically, somewhere between 50 and 60% of people who are on the program go from having an HbA1c of greater than 6.5, which is the diagnosis of type 2 diabetes, to under 6.5. So that and that doesn't happen with any other sort of way of treating diabetes. So greater than 50% put their diabetes into remission. But that's not to say that the other 40% don't have any improvement. So you might have someone whose HbA1c is 10 and they go down to 7. Well, they're not strictly speaking in remission, but you'd imagine that they're a whole lot better off, because they've got better glycemic control. And then maybe in the next 3 months they'll get down into below 6.5. So we also measure waist measurement, waist girth. That's all come down. The average weight loss in 3 months is about 5 kilograms, and over the 12 months it's about 7 to 8 kilograms. So it's a pretty dramatic effect for most people. Now there are some that don't respond. We have some in our cohort of 100 that haven't responded for various reasons. One had surgery and didn't stick to the diet, and there are a few who find it difficult to stick to the diet. I mean, that's an interesting topic, because a lot of the skeptics, a lot of doctors out there say, "Oh, you can never stick to this diet. It's too hard. It's too difficult. It's too hard." And my argument is always that the only people who say that are people who haven't tried the diet.
Right.
Yeah.
Because once you've been on this diet, you feel so good and you see the effects on your health. But that's very motivating. And people, if you haven't done it, you don't sort of understand that, I don't think. And that's why I think people are so skeptical and say, you can't, ketogenic diet, it's too difficult. I don't know about your experience, but I've not found it difficult. And every time you sort of slip up a little bit, you don't feel so good, so you get reminded that you should go back on it. So I think it is possible, and we're showing this from our research that more than 90% of people stick to the diet, and more than half of them put their diabetes into remission. So it's very rewarding.
Yeah. As you said, the naysayers are those who haven't tried the diet. That's point number one. And second point is, once you see the numbers or the improvements, you cannot unsee it. So as far as sticking to diet is concerned, it's very easy once you see the numbers. Now, taking this question forward, how easy do you find dealing with Indian population switching to low carb per se?
Yeah, well, it's certainly an additional challenge. We have a large Indian subcontinent population in Australia, and particularly in Melbourne, where I live. It probably presents an extra challenge because your traditional diets are very heavily carbohydrate based, so we have had a number of Indian, Asian, South Asian population on the program, and they've done very well. But it presents an additional problem because obviously there are cultural issues here, and then we need to be clever about it. And I don't think anyone's suggesting that you never have to have rice again. But I think a lot of the metabolism of Indian people is well attuned to complex carbohydrates and so on. So maybe it's not as difficult as it is for the Europeans. But certainly some of the results we've had have been very dramatic. Because they're certainly in Australia, there's quite a large problem with obesity in the Indian population, and we've had some very very positive results with that. But it does present an additional challenge, particularly when large families are living together, and maybe grandparents are living and doing the cooking and so on. That could be challenging for generations. But the results have been very impressive.
Great. And just a quick time check. We have 7 minutes left into this session. Anup, you have any other questions? Otherwise,
yeah, that's it. Primarily, the main concern is these diets are not safe.
Yeah.
Within quotes, they call it not safe. So just a short note from you on that.
Yes, that's a good question. Yeah.
Just to add to that, sorry about that, Anup and Dr. Brukner. But sure. Just to add to that is basically how sustainable low carb diets are. Yeah, safe and sustainable. Yeah.
Yeah, look, I think there's a lot of concerns, and you're exactly right. I mean, people say it's not safe. I've had doctors tell patients that you'll drop dead of a heart attack if you go on that diet. Because of this obsession with cholesterol, and I think that's been one of the real problems in medicine in the last 50 years. This over obsession with cholesterol, particularly LDL cholesterol. Most people, when they go on a low carb ketogenic diet, their triglycerides improve dramatically. Their HDL usually improves, and their LDL sometimes it varies. Sometimes improves, sometimes stays the same, and occasionally gets worse. But unfortunately, there's way too much emphasis on LDL cholesterol. It's interesting, isn't it, that people are obsessed with LDL cholesterol, and there happens to be a drug for that, whereas people ignore triglycerides because there's no drug. But in fact, triglycerides are probably just as dangerous for one's health as LDL. But what we find with this diet and the effect on LDL, it's not as simple as people think. LDL is not just one molecule, and it's the particular subfractions of LDL that we need to look at. And almost invariably, the LDL increase is due to the large fluffy molecules that are not atherogenic, and not the sort of the small dense particles that are. And so if you're at all concerned, you can always check those particles and see what. But I think it's unfortunate that people have this obsession with cholesterol levels, and cholesterol is actually a vitally important structure. Without cholesterol, your brain doesn't function, and I think we've gone way too far into obsessing about cholesterol. And we also know that the major risk factors for heart disease is diabetes. And pre-diabetes it's not high cholesterol. If you compare the risk factors, high blood sugars is way ahead of cholesterol. And so we've been focusing on the wrong thing for the last 50 years. And I think we really need to change our focus to sugar and processed foods rather than worrying about cholesterol, because we've known for 50 years that the cholesterol in food has no effect on your blood cholesterol. And yet, we've all been on these low cholesterol diets. We haven't been allowed to eat eggs for 50 years. I mean, what a tragedy. It's been terrible. So, I think I feel very comfortable that this diet is safe. And in fact, it's the opposite. It's the healthiest diet you can have.
Right. And just one quick thing, because I think we have been discussing about low carb. For our viewers, can you give some quick guidance in terms of percentage of carbs, proteins, and fats, basically to improve metabolic health or maybe achieve metabolic health? Anything that comes to your mind? Yeah.
Well, I think it's just a simple matter of focusing on foods that are high in protein in particular. I don't think generally we don't eat enough protein. Mm-hmm. And then avoiding. I think the real devil is this ultra processed food. I mean, it's and you can argue you shouldn't even call it food. It's sort of some chemical concoction that's dressed up to look like food. That really is not, and has so many different ingredients and colorings and emulsifiers and all sorts of things to make it look better, taste better, last longer, but actually doesn't improve the nutrition. And so any food that has 20 ingredients in it, as so many of these foods, you look at the food label and there's this long list of things. I mean, that's not food. That's a chemical concoction. And I think the trick is just going back to eating real food. There's a wonderful expression called JERF, JERF, just eat real food. And if you stick to that, I mean, you can talk about carbs and talk about everything like that. But if the real thing is avoiding the processed food and all the things that cause inflammation, because we know that inflammation is chronic inflammation is the key to developing chronic disease. And if we can tackle that with diet, then we can really do a good job.
And apart from the ultra processed foods, how about grains? Probably the last question. We have 2 minutes left here.
Yeah,
but
Yogesh,
how about grains? Your views on grains and beans? Sorry,
we'll get Shashi in during the last minute.
Oh yes. Right. So anything, because India is like Shashi says, we are a country of granitarians, right? I mean, we eat grains mostly. So
yes,
what are your views on that?
Yeah, I think we need to reduce our reliance on grains, certainly. So many people are affected by gluten and other factors in grains. And if we can replace that with healthier, higher fat foods, then we're going to be a lot better. But it's certainly a challenge.
Amazing. So thanks a lot, Dr. Brukner, for your time this morning. I know it's quite early in the morning, and I'll hand it over to Shashi. Thanks a lot again.
Thank you.
Dr. Peter, welcome. Thank you again for accepting this invite. And
my pleasure.
You are in Paris now, joined at 8:30 a.m. We are so happy that though you are not in Australia, you have joined this session right from Paris. And congratulations for being a grandfather now.
Well, thank you. Yes, I'm actually in Paris with my new granddaughter, so it's a very exciting time for us. So, but thank you very much for the invitation. Congratulations on what you're doing. This is a wonderful initiative, and I look forward to maybe coming on again at some for your future conferences. Thank you. Thank you for having me.
We'll be so happy to invite you again.